Imagine this. You're a 27-year-old young female. You just had your dream job. Life is moving fast. You're quite excited about your achievements. But unfortunately for you, every single month, like a clockwork, your body shuts down. The pain you feel is so intense. It feels like knives are twisting inside you. And here's the worst part of it all. Nobody believes you. Everyone thinks that you are being dramatic about your pain. Like, it's just cramps, or everybody has it and you should find a way to deal with it. But you are the only one that knows that this is actually beyond the normal. Like, this is horrible. It's messing up with your life. It's messing up with your job. You can't do anything. The pain is unbearable for you. That was Sarah's life for years. So let's talk about this girl, Sarah. Sarah is a young woman who had come to discover that her period pain was unbearable. She have heard of period cramps. She knows people have period cramps. People take medications when the pain is unbearable and they get better. But unfortunately for her, sometimes when she even takes medications for her period cramps, she doesn't feel any better. It totally messes up her life. She's scared every month whenever it is time for her to see her period. And worse still, she has other strange symptoms that are associated with her period. And she feels like she has the worst condition ever. And the bad part of it is that everyone thinks she's being dramatic. Sarah had to learn to grow used to pretending. Sometimes the period pains are so intense that it makes her miss out on going out with her friends. So she just pretends that she doesn't want to go out, so that every time she doesn't want to be the victim every month. She doesn't want people feeling sorry for her every month because it's like a clockwork and she's getting tired of it. Sarah has known that her condition was beyond ordinary, and she was right. Her condition is beyond ordinary. She has a condition known as endometriosis. Endometriosis is a condition whereby tissues similar to those lining the endometrium of the uterus are found growing outside the uterus. Now, they can be found in the ovaries, in the fallopian tube. Sometimes they can be found in the bladder, and in very rare occasions, they can even be found in the lungs. Now, here is the issue. Every month, this tissue acts like it would in the uterus. It grows, it engorges, and during the menstrual period, it sheds, it builds up, it breaks down and bleeds. But the blood has nowhere to go. So sometimes it gets trapped, causes inflammation, severe pain, and even scarring. So one day, Sarah dressed up to go for work. She was all excited. She was ready. She has been making a presentation for a long time that's going to help her company land a major project. But unfortunately for her, her period started. She felt severe pain. She was rolling. She could not make it to her meeting. She was at home. She was stooling. She was vomiting, and she missed out. And because of her company also missed out on that major project. This was when Sarah was like, she can't take it anymore. She has to seek help. She has to really do something about it. So luckily for Sarah, she was able to meet with a doctor who knew exactly what was wrong with her and told her her diagnosis. The symptoms that Sarah had and narrated to the doctor are common symptoms in endometriosis, and I'm going to be telling you about them. One of them is painful periods that affect your daily life. Yes, some ladies have painful periods. They have dysmenorrhea, which is painful period. Why some ladies actually go on in life and they don't feel any pain during their periods. How fortunate. While others, they feel pain during their period, but it's manageable. They take pain reliefs that have already been prescribed to them by their doctors and they feel better. But unfortunately, it has been seen that most ladies with endometriosis actually do not respond to the same pain reliefs that is given to women who do not have endometriosis, that they just have period pains. So that's why it is quite severe. Their pain is quite severe and it should be treated as such. Another symptom is feeling pelvic pain even when you are not menstruating. Okay, I want you to listen as I outline the symptoms. If any of them sound like you, then you know that you need to see a doctor. Here are some of the symptoms that Sarah outlined and mentioned to the doctor, and these are very common symptoms in endometriosis, and I'm going to be telling you all about them. Number one is painful menstruation. This is not just everyday menstrual cramps that some ladies feel. Okay, we know that some ladies feel menstrual pain, some do not feel pain at all during their periods. Those are like really fortunate ones, while others they feel pain, but when they sometimes take pain medications or do hot massages, mind care here and there, to manage menstrual cramps, they feel better. But for ladies with endometriosis, this care, these medications that are given to women that feel menstrual pain, it usually doesn't work for them. Their pain is severe, and it's severe enough to hinder their daily activities. Another example is pelvic pain. Ladies with endometriosis, they tend to feel pelvic pain even when they are not on their periods. So if you experience something like this, then do well to see a doctor. Another symptom is pain during urination or moving bowel. So if you have to use the toilet, and each time you have to use the toilet, you're feeling pain around your pelvis, you're feeling pain when you have to move your bowel, or you're feeling pain when you have to ease yourself, this is another symptom. Noticing heavy bleeding or spotting between periods. This is another symptom of endometriosis, whereby ladies they start to experience that their periods are irregular. Sometimes they just have heavy bleeding or they just have spotting even when they are not seeing their periods. Another feature that have been seen in endometriosis is difficulty in getting pregnant. So when some women they'll have complaints of usually having severe pains during their periods, and they are further evaluated and they are saying that they are trying to get pregnant but they are not getting pregnant, it's possible that there have been some scarring because of this endometriosis, and it has led to them having difficulty in getting pregnant. So if any of these symptoms I've mentioned above sound like you, do not ignore, do not feel like you have to, is a pain that you have to deal with, or do not allow the fact that maybe people around you have been ignorant and they tell you that everybody feels it, but you know that yours is different. Then you need to seek expert medical care. Go to the hospital, see a doctor, and get evaluated properly. After Sarah had gone to see the doctor and she had narrated her symptoms to the doctor decided that she should do a pelvic ultrasound scan. But guess what? The pelvic ultrasound scan came out normal. So this is common in endometriosis. Usually the pelvic ultrasound scan will not pick it. Endometriosis does not usually show up on scans. So the doctor scheduled a laparoscopy, a minor surgical procedure which allows the doctor to look into the abdomen directly with a tiny camera. That was when they saw it. They saw lesions in her ovary, scar tissues wrapped around her pelvic organ, and Sarah was diagnosed with endometriosis stage 3. So now you may be thinking, so what caused this? Just like Sarah, I started to think, what had caused this? Why does she have endometriosis? What did she do wrong that she has endometriosis? What led to this? Is something wrong with her? Okay, here is the thing. The actual cause of endometriosis is not known, but there are different theories that tend to explain it. There are theories of retrograde menstruation, theories relating to genetics, theories relating to the immune system. But here is one thing you should know: it is not your fault. If you find yourself in such a condition, or you find out that you have been diagnosed with endometriosis, it is not something that you did or that you could have done differently that made it to happen. So how did Sarah get her life back? Did Sarah ever get her life back? Is her life completely ruined because she has endometriosis? No. The doctor was able to find a way to help Sarah. The doctor placed Sarah on hormonal therapy to suppress the estrogen that was fueling the endometriosis. She also started doing beneficial exercises, improving her diet, improving her lifestyle generally, and eventually she had to do an excision surgery to remove the tissue. It didn't kill her because endometriosis is chronic, but it gave her something that she has not had in years: control and hope. So if your body is screaming at you, listen. You are not weak, you are not dramatic, and you are definitely not a liar. You deserve answers, you deserve relief, and like Sarah, you definitely deserve to be heard. So if you know that any of the symptoms in this video relates to you, do well to seek professional guidance from your healthcare provider. This story is completely fictional. Sarah is completely made up, but the facts about this story are true.